I'm very grateful to be here with my colleagues, Senator Booker and Senator Paul, our extraordinary advocates on this and other issues. I'm really here to talk about some families in New York that I met. One of them's here, Kate Hintz and her daughter Morgan. You can see Morgan, and she is a little girl who has a very serious disease, and many children in my state have similar afflictions, and they feel the real pain of the current federal laws as it relates to medicine that their doctors have prescribed. Kate, our mom, she is not a full-time political advocate. She's a full-time mom trying to do the right thing and to help her child get the medicine that would ease her chronic pain. Kate and Morgan sacrificed a lot to be here. It is not easy to get here. And they are simply asking Congress to do its job, to take care of America's kids. Across the country, state lawmakers have already recognized what medical research is showing us, that cannabis can treat a variety of illnesses from MS to cancer to epilepsy to seizures. Medical marijuana is legal in 23 states plus the District of Columbia. 12 other states have laws permitting the use of cannabidiol, which is CBD. It's a strain of medical marijuana that has almost no THC and doesn't cause a high. This is the medicine that so many parents have been prescribed for their children who have these seizures, daily seizures, hundreds of seizures that actually prevent these children's brains from developing fully and living the fullest life they can. Instead, the federal laws threaten prosecution of the patients, of the doctors, the providers who participate in medical marijuana programs. And these laws, as Senator Paul said, severely restrict the scientific research of medical marijuana. They prevent the transparent financing for medical marijuana dispensaries, forcing providers to rely on dangerous cash-only businesses. These laws ignore the health benefits of medical marijuana. This is clearly a case of ideology getting in the way of scientific progress. The government should not prevent doctors from prescribing medicine that has shown to work. And the government should not block families from accessing treatment that would ease their children's suffering. Under current law, patients and doctors are forced to either forego necessary care, which Morgan has to do, or use alternatives that often have severe side effects. And those who do obtain medical marijuana risk arrest from federal authorities, even if they're in compliance with state laws. As the families told me when I visited them in New York, they aren't just afraid of prosecution. They're afraid of a knock on the door from Child Services, coming to take their children away, all because they chose to give their children the medicine that doctors have prescribed. Senator Booker and Paul and I are introducing this new bill, the CARERS Act, which would recognize that marijuana has accepted medical uses and would recognize the will of voters in 23 states that have decided that denying families access is wrong. The bipartisan bill would finally allow patients and families, including veterans, in those 23 states to access medical care without fear of prosecution. It also reschedules medical marijuana to a Schedule II drug as opposed to a Schedule I drug, which is what, as Senator Paul said, would allow more research. It would also lift bureaucratic restraints so that this research can be conducted across the country and by CDC. We need to modernize our laws, and there are too many stories like the ones I heard just a few weeks ago. An 8-year-old boy named Donnie, who has since died of brain cancer. Instead of being allowed to take small doses of medical marijuana, which would have provided relief and reduced anxiety more effectively, he was stuck taking powerful opiates, which weren't always effective, and left her unaware of her surroundings. Or Oliver, who I just met, a little boy whose life is interrupted by over 100 seizures a day. Those seizures impair his life and impair his cognitive development. If he was able to have small doses of medical marijuana, it would stop his seizures and allow Oliver to live his life more fully. Instead, he has to take powerful barbiturates, which are addictive and not always effective. Now, Morgan, Kate's daughter here, she has Dravet, which is a syndrome that has a very rare form of epilepsy that has no known cure. I've met several children that have this disease. Even though there's a growing scientific consensus that medical marijuana actually helps control these seizures, Morgan's mother would have to violate laws and risk arrest just to give her daughter the medicine she needs. So these stories are not, they're not the only ones. And I urge my colleagues to support the CARERS Act. It gives the parents the ability and option to treat these diseases more effectively and to ease their children's pain more effectively. Now I'd like to introduce Kate Hintz, and she's one of our best advocates on this issue.
Good afternoon. My name is Kate Hintz. This is my daughter Morgan. We live in North Salem, New York. As you can see, we don't travel very far or go for very long without Morgan having a seizure. She just had a very mild one while Senator Gillibrand was speaking. So I am very happy to be here today supporting this bill. I am a stay-at-home mom from New York. I am not an advocate, so to speak, as you mentioned. We've been advocating for access to medical marijuana for almost 2 years now. Morgan is 4 years old, and she suffers from a severe form of epilepsy called Dravet syndrome. She has seizures almost every single day. Her seizures started at 9 weeks old. Upon her first admission to the hospital, she was started on an anticonvulsant medication. Within 10 days, we had added a second. Within a month, they had added a third, and I was forced to watch as Morgan became unresponsive and lifeless from sedation. What doctors didn't tell us is that over 30% of epilepsy patients have seizures that cannot be controlled with treatment. Morgan depends on a feeding tube because she cannot eat or take her medicines by mouth. She cannot sit, stand, or crawl independently. She does not speak and requires constant supervision from a nurse. She has trialed and failed over 10 different anti-seizure medications, yet at best, Morgan has only ever gone 4 weeks seizure-free. At this point, we will never know what has affected her more, her uncontrolled seizures or the mountains of medications she has taken in her short life. There are thousands of families in the U.S. living under similar circumstances, some patients having 1 seizure a day and some having hundreds. But some of these families are living in states with existing medical marijuana programs. And because they too had trialed almost every available medication, they decided to try something new. Medical marijuana that is selectively grown for specific cannabidiol profiles are proving to be a safe and effective treatment in treatment-resistant epilepsies. So promising are the results, most of the leading children's hospitals in the U.S. are involved with some sort of a CBD clinical trial. This news spread like wildfire through the epilepsy community. The momentum to gain access has been unprecedented. Many families instantly picked up their belongings and headed to Colorado and are now dubbed marijuana refugees. Other families have quietly begun to travel back and forth, transporting medication across state lines to their children and loved ones, and thus committing a federal crime. Some families like mine turn to our state government for help, and although a few states have successfully passed medical marijuana bills, most of them are fragmented, overthought, and overregulated because they have no guidance on a federal level. Today, with the introduction of this bill, that can change. Individual state programs will never succeed until they are supported at a federal level. Across the country, advocates have been waiting to see who would take the first step, who would listen to our stories, our struggles, our confusion, and realize that enough was enough. And today we have our answer. Senators Paul, Gillibrand, and Booker, from the millions of epilepsy patients living in the U.S., thank you for ignoring the stigma and instead focusing on finding us a solution. Thank you.
Very well said.
Thank you.